Grandpa, watch this!
Look at you. You know, just 4 months ago, I couldn't have imagined spending time with my grandkids at the park. To tell the truth, I was barely living. Getting through the day was pretty rough. I'm here today because some students and teachers at the university took the time to listen to me and help me take better care of myself. Hi, I'm Carl, and I want to tell you about my experiences working with a team of people who truly had my best interests in mind. I lived in a one-room apartment. There was not much to it, but it was home. I have diabetes, heart failure, and emphysema, but didn't really know how serious my situation was. I tried to take my pills, but there were 12 different kinds. It was too confusing. I had a lot of shortness of breath, so the doctors gave me oxygen, but I didn't like wearing it. So when I couldn't breathe, I'd get scared and either call 911 or find a way to get to the emergency room. They'd always tell me the same thing, that my oxygen level had fallen too low. Sometimes I even had to stay in the hospital. I'd been to the ER 36 times in the last year. I guess that's a lot, but what else could I do? I struggled living on my own, but I didn't want to tell anyone. I was afraid they'd put me in a nursing home. The kitchen on my floor was far away, and it was always crowded and dirty, so I would heat up meals with my microwave, even though the doctors told me to eat healthier. Since I couldn't get around very easily, it was hard to go anywhere. My family hardly ever came to visit because they lived far away, so I was alone most of the time. Usually, after I had stayed in the hospital, a nurse would stop by to see me. He was nice enough, but I wasn't great at following his advice. He'd teach me about my medicine and encourage me to take it regularly, but that wasn't the only problem. I had to pay for it and find someone to pick it up for me. It was just easier not to mess with it. He'd also bring up me moving to assisted living, but I told him everyone I know who ever went to one of those places died. Once, when I was at the ER, someone set me up with a doctor at my neighborhood clinic. I went to see her a couple of times, but most of the time I didn't make it to my appointments because I had no way to get there, and I usually forgot about them anyway. Each day was pretty much the same, and it wasn't long before I ended up back in the ER. The doctor helped me schedule an appointment at my neighborhood clinic again. This time, the nurse asked if I'd like to be referred to a program at our local university. At that same visit, I met with a teacher from the university. They were evaluating a program that was created to make life better for people like me. I wasn't that interested in it at first, but I signed up because I knew I needed some help. The teacher and a couple of her students came to my place one day. They took a lot of time with me and were really listening. They asked me lots of questions about my home, health history, family, how I felt about my living situation, and what was important to me for the future. One of the students was learning to be a doctor, another a nurse, and the other a pharmacist. Their teacher was a nurse who taught at the university. The students came regularly. One time, I told them that my tooth hurt. The nursing student looked in my mouth and made some notes on her iPad. The next visit, a dental student came along. She looked in my mouth and made an appointment for me in the clinic for that week. I was worried that I was going to forget about the appointment, but the nursing student arranged transportation for me and met me at the office for my appointment. The dentist took out my tooth and showed me how to make sure my gums healed. The dental student checked on it the next time they came to my house, too. I started to look forward to these students coming to see me. In a way, I kind of started taking better care of myself, just because I didn't want to let them down. The students had put up signs in my place to remind me to wear my oxygen mask and taught me breathing exercises. They helped reduce the number of medications I had to take and gave me a calendar with the times and amounts to help me remember. One day, probably when the students were over, my daughter was visiting. We started talking about what I wanted to happen if I got sick and might die. Kind of surprised me, but I guess it was probably a good thing to figure out, just in case. So we filled out some paper. We also filled out a form so I could start getting Medicaid. It was a relief to know I could get some help to pay for medicine. Since I signed up for the program with the university students, I haven't been in the ER. I can take better care of myself. I think it's because the students and their teacher really listened to and supported me. Now I am living in assisted living because I see how extra support can make your life better. The best thing is, I'm here with my grandkids and daughter and enjoying a day at the park. I thought my chance to have these days had passed.